There are two pathways through which we anticipate or through which we know from the science that long working hours get under the skin or get to your heart or to your brain. And that is, first of all, they cause stress, and stress causes release of hormones that directly impact your health negatively in this way. And then the second pathway is that long working hours make you have riskier behaviors, such as smoking, lack of physical activity, or sleep deprivation, and that can also lead to cardiovascular disease.
How do other risk factors like gender, like age, location play into it?
We have not found any evidence that sex or gender makes a difference for your risk of having cardiovascular disease events after working long working hours. However, we do find that the burden of disease is larger amongst males. So the total number of people who die from cardiovascular disease is 70% of these people dying are males. And that is a result of more exposure amongst males to long working hours. We've also found that some regions are carrying larger burden. That is the Western Pacific region and Southeast Asia. And of course, as with all cardiovascular disease, it affects mostly middle-aged and older-aged workers.
Now, this research has been done quite meticulously, but it doesn't cover the COVID pandemic, which has changed the way we work. So do things like the surge in remote working and the economic slowdown, do they increase the risks?
We all know what it's been like to be in lockdown, right? So we've been working from home, we've been teleworking. And you might have seen that the Director General of the World Health Organization has linked teleworking and working from home and national lockdowns to some degree to a blurring of what is work time and what is personal time and rest time at home. So there's some potential concern there. Also, we know that there have been economic downturns as a result of the COVID pandemic. And we do have some evidence that suggests that national lockdowns may actually, ironically, increase the number of hours worked. So a study from the National Bureau of Economic Research in the United States estimated across several countries that it's a 10% increase in working time. What we have to do now is we have to rebuild better. We have to make sure that we don't increase number of working hours as a result of the pandemic, but that we keep to healthy working hours. And this will also keep workers more productive. We know that there are productivity gains.
You talk about productivity gains. So what are the next steps? What would you like to see governments do about this?
The next steps are regulation. And many countries and regions have already implemented the types of laws and policies that we need to see. We need to see limits on working hours established, implemented, monitored, and enforced where necessary. There are many positive examples, but one positive example I want to highlight is the European Working Hours Directive, which limits hours of work per week to 48. A second intervention can be to rearrange working time. So we must work smarter, not longer, right? So we can rearrange our time and also make sure we can have shift work, we can have flexi time arrangements.